Business show in RVA. On the mic with Mike in RVA.
RVA's leading social enterprise show. On the mic with Mike King Biz, delivering food for thought. To find out more about the dynamic host of On the Mic with Mike, please visit his website at mikekingbiz.com.
I enjoy listening to
This is for my conservative friends. Ladies and gentlemen, welcome back on the mic with Mike. It is the premier business radio program around. I'm your host, Mike King. This is part of our Poplar Springs Hour right here. Good friends down at Poplar Springs Hospital. Make sure you go check them out. They're doing some outstanding work. Poplar Springs Hospital. Caitlin is with us today. Lamar is usually here, but Caitlin, come on, step in, and we're going to go with the elevator pitch, who you are and what you guys do.
Hi, my name is Caitlin Metter. I'm the community liaison for Poplar Springs Hospital. We are a behavioral health hospital located in Petersburg, Virginia, and we provide a wide variety of services for adults, adolescents, and military. We have an inpatient hospital for individuals that may be in crisis for adults and adolescents. And then we also have a military facility that treats active duty veterans and military dependents. We also have an adult outpatient facility. So for those that are functioning but barely functioning, they can please come to us and we can provide some structure. We have 5 and 3 day programming, including an evening program that's available as well. And then we also have residential treatment for adolescents ages 11 to 17, both male and female. To reach us, you can contact us at 804-733-6874. You can also visit our website at poplarsprings.com, or if you are in immediate crisis and need some immediate assistance, please give us a call or walk straight to our door and we'll be able to help you out.
24/7, you guys are there to help.
24/7.
All righty, thank you, Caitlin. On the mic with Mike, the best business radio program. This is the Poplar Springs time. Poplar Springs always brings the coolest guests because they're on the cutting edge of what they do. And now this next gentleman they're doing some revolutionary. That's what I think is revolutionary. Maybe it's just cutting edge. So, sir, who are you and what do you do? This is the elevator pitch of a business program.
All right, I'm going to try and do my best here. My name is Jared Reisweber. I'm a clinical psychologist. I have to start with a disclaimer. I do have the possibility of receiving a percentage of royalties, but that has not happened yet. And what we are doing is developing what we believe to be a cutting edge treatment for substance abuse that we're using in the Veterans Affairs and actually all over the place. So we're training folks in Richmond. I think the last 3 years, we were training about 40 clinicians a year. Training in Europe, and we're training going to be in Africa and then Asia also. But transcending self-therapy, just to give you kind of a brief overview, it's a form of integrative cognitive behavioral therapy. And so cognitive behavioral therapy is kind of the gold standard for substance abuse treatment. It has like 70 years of research to support it. And what we did is we added to it, or we made it, I think, a little different, and it's being done across the VA and is really, really effective. And so what we did is, in addition to cognitive behavioral therapy, which is helping the patient identify their thoughts and their behaviors that are not helping them, we're also trying to help them understand where their moral compass is pointing them. What path should they be on when they look inside their heart or their soul? There's a phrase, and it said, religion had forgotten the mind and 20th century psychology had forgotten the soul. And
okay.
I think there's something to that. And what we've done is really had the patient come in, look at their cognitive distortions, how they're thinking maybe in a not so healthy way, but then say, there's something inside you. I don't know if it's God or what. They don't have to believe in God or anything like that. But what is your morals telling you to be? And once they sit with that, that starts to pull them into recovery. That starts to make them want to be better. Because I think inside of every person, there is that great potential. And transcending self-therapy is really about helping them become the best versions of themselves.
Let me ask you, what did the pandemic, these last 24 months or so, do to what you guys have been working
on? That's a good question. So we had to pivot quickly. And I'm proud to say that the Richmond VA did a really, really good job of this. we pulled together, and instead of shutting down our residential program, we were one of the few residential programs to stay open throughout the majority of the pandemic. And so we just had to transition to virtual care and develop virtual modalities. We even went into virtual reality. We developed a virtual reality platform now where patients in our residential program can put on a headset, go into an immersive virtual world, and learn techniques and concepts that will help them on their recovery. And we did that by partnering with Concio, which is in the private sector, and they've just been really good partners.
Can you talk about taking approach using virtual reality? Why is that so important, and how is that helpful to the person who's in need of help?
So that's a good question. I think at times there's a correlation between having some poor attention skills neurologically at times, not all the time, with folks that are abusing substances. And so when we're assigning them paper and pencil homework, which I do after every group and say, go through these 10 questions.
Why paper and pencil? Is it something old school?
That's what we've been doing for 100+ years. And so what we're doing now is saying, these guys like to put on a virtual reality headset where they can come in and it's as if you and I are talking, the experience of it, and they're way more attentive. They'll say, I got the concepts because you explained, cognitive distortions, and I could go replay until I got it. I didn't have to raise my hand in group. And so we're supplementing what we're already doing in the in-person therapy with now these virtual techniques and these virtual platforms. And I think it's leading to really, really good care and really good results.
As a clinician, what does that technology do to help you?
Eventually, I'll be able to know where did they get stuck? Are they getting stuck understanding a certain concept? Are they getting stuck with positive talk towards themselves? Are they not doing it all? Are they spending 2 hours in there? And so I eventually will be able to get a readout of how much time where your patient, was in this module, and did they successfully do it? Because there's quizzes in there too, where they can, and they have fun with it. That's the thing, is making it fun.
So it doesn't seem like all work and all drudgery. They're having fun and getting better.
Right. Yeah. They're spending hours in there sometimes a day.
So on the mic with Mike, ESPN Richmond, Poplar Springs Hospital, we have the doctors in here talking to us about cognitive behavior
Therapy.
So, and you've been trained by one of the best, who's right at the forefront of something that's new and cutting edge. And sometimes when things are cutting edge, it makes certain people nervous.
It does.
It does make people nervous.
In fact, I was nervous coming out here talking about it.
Nervous?
but yes, Aaron Beck was my supervisor. He and I co-authored a book, and he actually passed away, God bless his soul, at the age of 100 about 6 months ago. But he's a beautiful human being, and he led the advancement of therapy, and we're now trying to kind of add on and build upon the great work that he did.
When you first met him, did you see greatness right away, or did it take you some time to realize what he was talking about?
That it was, I saw fear in myself, and I was like, don't screw this up, Jared.
Exactly. There's a guy not to screw it up. It's this guy.
Right. But then I did see his greatness after I could get through my own, I guess, insecurities about being in the room with him.
So what's the next step for you and your organization, the next big step? Because a lot of things that go on with technology and medicine happens behind the scenes. There's a lot of, like we had the director for Massey Cancer, and I had said to him, how'd you guys come up with this, treatment for COVID so quick? It makes people wonder, like, hey, how could you, and how come we haven't figured out cancer? And he says, because we have been working on the COVID vaccine. It's been there before, it's there. Remember bird flu and all those things. So he says, we need to do better with getting that information out to the public. So right now we are talking about the whole idea of, addiction and overcoming that. We've had our biases about that for a very long time. Has COVID changed some, or the year that it has changed that? And how can the people in the industry get better at having us understand what are some of the new things that are coming?
I think I'm going to indirectly answer that, but tell me if I miss part of it. But I think, I mean, substance abuse has just gotten so out of control, and we're saying we need to do something to treat it. And I work at the Richmond VA, and I think they're doing a really, really good job. And this is not just a plug, it's actually true in that we have supportive staff. We have a supportive chief in Mary Bradshaw and Ron Johnson as director, but there's a thing called the Innovation Network. And so this is, I think, answering the question is sometimes for an invention to reach marketplace takes 15 years. The average lifespan or the practice span of a doctor is right around 30 years. And so by the time the provider's ready to retire, he's not been trained on that. He's using what he was trained on 30 years ago. And so we have this thing called the Innovation Network, where they're taking frontline providers, so staff like me, and saying, do you think this is good enough? And we're saying, no, I think I can try and improve it. And so we're developing these 4-session protocols, group therapy, individual therapy, books and facilitators guides. In the last 6 years, I think we wrote 6 books, and it's being supported because the VA is trying to push the field forward. And yeah, they're putting it in the hands of frontline providers who are saying, what do you need? And how do we make this work? And then we're researching it. We're showing some of the data on transcending self therapy says we have 2 to 3 times less positive urine drug screens in folks that had transcending self therapy compared to treatment as usual. It's 2 to 3 times more effective. So you know, 50% are relapsing versus 17.6%. And that's a big deal.
That is a big deal.
And we're having, and these are in peer-reviewed journals where transcending self-therapy is having it so they're less likely to need a higher level of care. That we had in one program review, nobody needed a higher level of care going through our outpatient program compared to 22.6% needed higher level of care, meaning we treated them in the outpatient versus needing to go to a higher level of care. And that has access and financial ramifications.
So you think it's possibly because they've tapped into something internally that says, I want to be better.
Yeah, and that thing that pulls at you, you have a calling, just like I have a calling, just like I think all people have a calling. It's funny, and to be clear, transcending self-therapy or TST makes no ontological claims about the legitimacy of any religion. Right. But what we're talking about is in every major religious text. We're not saying that any religious text is right, but it's saying there's a calling for you. Love yourself, be compassionate to yourself and others, and you got a calling. There's something that you need to be doing. And I think that awakens the spirit in a lot of people.
Why is it at the VA? Like, why is the VA on the forefront of this? Is there a rhyme or reason to it? I'm sure there is.
I mean, I think it's creating an innovative space where they're saying, hey, we're going to allocate some of your time to improving things. I think part of it was I ended up there and I saw the protocols that were being done. And I was like, I think we could improve this. And then there's a mechanism for providers to do it and research it.
How receptive and open to the old school doctors? I mean, come on, man, you're trying to teach sometimes some old dogs new tricks. And sometimes we could be a little bit, I'm not sure, but they're medical professionals. They want to offer what's the best, but I don't know, like you had said before.
So that's a good question. Dr. Beck would say, if you research it, you really don't even have to schmooze them on it because you can just say
the data is there.
The data supports this notion. And I found I had a training that was supposed to be like 25 people and there was over 1,000 participants. People who get into substance abuse treatment, there's a large contingency of them that their hearts are in it, that their dad went through it or their uncle went through it, and they want effective interventions, and they're seeing what we're doing. It makes sense. It's easy to implement. We have great data. And so people have been super supportive. It's kind of caught fire.
So on the mic with Mike, ESPN Richmond, part of the Mike King Biz Radio Network, which is ESPN Richmond 106.1, The Choice 105.3 every day from 2 to 3, as well as International Business Growth Radio. How can people find you and get more information about your topic?
That was, as I was sitting here waiting, I was like, I should have had that really thought out. Transcendingselftherapy.com. So TRANSCENDING self, SELF therapy.com has a site where you can purchase the materials, see a lot of the presentations that I've made.
And who would go there and get that? Are there parents or people who are looking for help for their loved ones? Or these are clinicians, medical people who are looking to see what else is out there from an effective basis?
Yeah, I would say it's the latter. It's clinicians going there. So now we're getting contacted. Different countries are asking for us to come out and train their country on how to do it. So
let's look at that. Where does America fall on the scale of being very effective and cutting edge to we're kind of old school?
My knee-jerk reaction is to say it's horrible that we're the best. But I know that's obnoxious to so many people.
But if that's the case, then that is the case.
I like to think we are. I'm sure a lot of people would disagree. I do think, I mean, Beck's lab was in Philadelphia, your old.
There we go.
So I think that America, but I mean, there's good stuff being done in Europe and in lots of places. I think if I were to have thought through my response, which I should have, I would say a lot of different countries and places have a lot of good insights to offer, and we can really learn a lot by not saying America's best every time, like I just did, and instead saying, let's learn from each other and let's.
Is there a country, and let's still staying on the theme of from a global basis, is there a country whose mentality is kind of good and effective compared to where we are right now, that people are more open-minded to substance abuse help as opposed to where we are?
So people like Portugal are there. A lot of people are applauding the work that they're doing over there, in that they're like decriminalizing a lot of stuff and offering microloans to people. But I do think that there's a lot going on in America. When I train overseas, they're looking to see what we're doing.
Okay.
So we're kind of sought out, I think, in large part to train, especially because of cognitive behavioral therapy. And because we had the Albert Ellis, the Aaron Beck, the kind of the big guys.
Are those standards worldwide now, their thought processes?
It's spreading. I mean, I've gone to the Middle East to train doctors there. I've, where they're asking us to come over and train and kind of learn that way. That being said, I'm sure I don't know what I don't know, and there's probably a lot of great things happening in other countries that I'm just not as familiar with. I'm just very proud of the work that I'm seeing being done, and that we're doing in the VA. This is a very different VA, and we were talking about that it's much improved in the last 7 years. I think it's
so shout out to the VA. People, a lot of times people really have given a knock on it, saying all those things. The service and care that we receive at the VA is outstanding. Do you have to work? We have to work at your healthcare no matter where you are. And for folks who go to VA, they understand it is an adventure. It's not going to like a Hershey Med or some regular medical center. This is an adventure. These are people who live lives and they got stories, and they are dedicated people who are at the VA. So on the mic with Mike. So Doc, here, I always ask people, what's happening in the streets? How are people doing as we're coming out of COVID? What's happening? How are people doing?
That I would say not good. I think a large part of combating mental health issues and substance abuse is connection with other people, connection to a passionate pursuit, something that's meaningful. And I think that's taken away. And I think the fragmentation of society is really, really bad for mental health. Right now we have, a Facebook page, which is really just a highlight reel of all the good things happening in your life.
Which makes you feel like crap when you look at like, how come Like, my life isn't like that.
Exactly.
And which you have to be able to understand. And I don't care how many times you say that. When you look at somebody, you're thinking, boy, they didn't put the real stuff up there or the bad stuff, and
Yep.
you're going through that. So that is real. And that's for people my age, that's younger people. But when you start doing that for adolescents or kids
Horrible.
even younger, it's like before bad stuff ended when you left school a lot of times. Now it's with you 24/7.
And that's the thing too, is that human connection. We need to get back to that. And you see it at the VA too. My father-in-law is a Vietnam vet, and my grandfather was World War II vet. But they go to the VA and there's a mall and people are hanging
Yeah,
out. And
it's an adventure.
Right.
There's storytellers that, hey, back in my day in 1967, right? But you'll always remember that person there and the people who work there, whether they're young or older. There's a camaraderie that goes on there because it's men and women who had served, and you have an understanding. And so when we look at like a substance abuse problem, whenever you call a VA, first thing you're like, are you suicidal? Are you having some issues? Because they know, especially now that we didn't realize how much we need people as to when we were sent home.
Yeah.
And the whole world got put on timeout. And next thing you know, we realized when you had kids dying to go back to school, you knew what time it was. Yeah.
And parents, I have 3 kids myself, parents very ready for those kids to go back to school.
For sure. I mean, remember we used to live for 3-day weekends, and then we had a bunch of 3-day weekends back to back. I mean, we had to stay in. And so all of a sudden we realized, what do you think is on the forefront for this whole idea of drug therapy, interventions, as well as, your field? What do you think the next big breakthrough is going to be?
I think that expanding this notion of connection of, for years, there was this idea that psychology and spirituality.
You had said that. Yeah, it did.
Need to be, I think, getting back to what people are passionate about and integrating that into the therapy. I think meeting people where they're at. We're about to start working with chaplains because there's a large contingency of veterans that commit suicide, but they're never connected with mental health because of the stigma. And so we're looking at training the chaplains and even the chaplains from the VA to go up to the chaplains in the community and the priests and the imams and the different spiritual leaders, because that's where a lot of people get their mental health care. And so meeting people where they're at, doing the VR, doing the gamification of it is really trying to expand it and meet people where they're at.
On the mic with Mike. Doc, how can people find you out there one last time?
transcendingselftherapy.com. My name is Jared, Jarrod Reisweber, Reisweber. And you can just Google.
Just Google you.
And
how many other Jared Reisbergers are there?
There's no other Jared Reisweber. Reisweber.
All right, so there are not any other ones out there. How do we find the next person who sees you? When you found Dr. Beck, how do you find, where's that next person come? What is their interest that takes them down this road?
So, are you asking, where does that next person, where are they going to come from?
Yeah, where do we find them? What's their interest? How do we find that person?
That's a beautiful question. I got goosebumps when you asked it, because I think that's got to be the part of our push as a society, is to cultivate not getting a fancy car, but not getting a big house, but what does your soul say to you, son, when you're talking to your kid? What is, and bringing them out to a food pantry and talking to them about a person who is murmuring to themselves and saying they may be struggling with addiction, and let your son or daughter, I have 3 kids, sit with that sadness for an element, and it awakens a part of them. That's not right.
As a lot of times back in the day, you don't want your kids to see sadness or hurt and those things. And sometimes you don't equip them to be able to handle that because you didn't want them to sit and think about what they had just seen, which is something, because we always want life to be good for our kids, and we don't want people, period, are like that. You know, I have a friend who, her son, she has a group called Better Together, and it's for parents of kids with special illnesses. You don't fall into a segment of your kid has something that a lot of people don't have, so there's no real organization. And I asked her, "How you doing?" She says, "With a child with needs who's sick." That's a loaded question. Is if I really told you, you'd run away and your hair would be on fire, because you know people are like, "How you doing?" "I'm good," and keep it moving, because we don't want to think about that could be me with the child who's sick, or that could be me with the kid who has an addiction, or that could be me with the addiction. So sometimes we kind of bury that and keep it moving. So it's good that you sit your kids down and be like, "Hey, take a look at that," or maybe this is why. That's maybe a difference of generations, where we didn't come from that generation of mine. We looked over there and we looked and we kept moving.
And I think I said it before, the fragmentation of society. We're a tribal people. We're supposed to, for most scientists say we're 200,000 years old. And for 199,000 of those years, we were living, you would live 10 or 15 feet and your parents would live 10 and 50 feet, your aunt, uncle.
Like South Philly. Like South Philly, exactly. That's exactly what that is.
But that's what we
that holds
need.
the glue.
That's what we need. And I think we like to think we're the most connected society there ever is. And I think it's the exact opposite. We've Johann Hari says we've traded floor space for connections, and that's leading us to be one of the most disconnected societies. And I think we got to work to help the youth and people reconnect and get back past petty differences and compassionately understand one another and talk and listen to one another and compassion. I've seen it clinically for 2 decades be the key to recovery. And there's lots of philosophers and it's at the core of most major religious texts that compassion is the key. And I think we need to get back to that.
Knee-jerk answer, compassion, better or worse coming through the pandemic? Are we better off now, more compassionate than we were, or we're coming out and so I got to get mine?
I'm not going knee-jerk because I'm kicking myself for my clumsy America's great comment earlier, but
it is. You know what I tell people about America? We're the young people of the world who have money, and part of that, when there comes an arrogance, when you're the teenager and you're richer than your parents, and the world looks at you, that there are certain things that people every day, and being in the military, every day people wake up and want to come to America, regardless of the problems that we have here. Every single day, somebody wants to, Americans, what we want to do, go on vacation. We'll go on vacation to that place. But you know what? For all of us who will leave and go live somewhere, most go and come back. Foreigners want to wake up every day and come to America because they figure I can make it there. That is the land of freedom. That's what military fight for. That's what all the people do here. So, all right. So, ladies and gentlemen, that is my soapbox. That's the soapbox. But are we better or worse, pandemic-wise, for compassion?
I want to say better, and with some minor changes that are major, we can get.
No, wait, Doc, come on now. So that they're minor changes, but
well,
they're big ones.
Yeah, I think we got to start listening to each other. Everybody just needs to start listening a little bit more and compassionately understanding. And with that, it'll build like a desire to go and help people of different groups and for people to work together. So I think final answer, we are more compassionate, but I think we have room to grow, a lot of room to grow.
I think we're more compassionate, but my wife calls me kumbaya guy. I think that we are more compassionate because we were sent home and we had 2 years to think about that, and we miss people. Oh, we still have issues and stuff like that, but I think, well, it's me thinking this social experiment called America works. That's just me.
I hope so.
Come on, man, you got to be more.
No.
You please.
No, I believe it, but we got room to grow.
We do have room to grow. All right, so Doc, I'm gonna have you on over at the other station with me. It's interesting, fascinating what you're doing. On the mic with Mike. Doc, one last time, how can people find you out there?
transcendingselftherapy.com, and Jared, Jarrod, Reisweber, Reisweber. And I'm happy to respond to emails, all that stuff's up there, and be part of this change that we're talking about to make America a more compassionate place and hopefully the world.
On the mic with Mike, we bring you the best and brightest. That's what we're talking about today. So I'd like to thank you on the program. We got to run. As I always say, the microphone ain't free. Plus, my grandkids need something. Doc, this is just for you, since we had talked about Philadelphia.
Hey, yo, Richmond, it ain't about how hard you hit. It's about how hard you can get hit, but keep moving forward. This is the Italian stallion. Say the one I leave Philly and come to RVA. I always check out my man, Mike King Biz, on ESPN, 5-7 a.m. The champ of business talk radio. The man.
All right, ESPN Richmond, that's where we are. I'd like to thank the good doctor for coming in on the mic with Mike, the best business radio program around. We got to go. Take care now. Talk to you soon.